Welcome to The Beat, your go-to where leaders, founders, and investors share insights on growth, innovation, and business building. I'm Chitra Nabat, your host. Joining us today is Novlet Mattis, Orlando Health Chief Digital and Information Officer. Novlet, welcome. Thank you for joining us.
Thank you. Thank you for having me.
Novlet, Orlando Health, one of the leading providers in the country, has been recognized for its pediatric and adult trauma programs, more than $6 billion in revenue. Take us into the scale and complexities of Orlando Health.
Yes, Orlando Health has been a growing organization, especially over the last few years. We're in Central Florida primarily, but we have expanded to the west coast of Florida, and we have practices all over the state. And one of our major strategic imperative is growth and innovation. So we intend to grow to a $10 billion or more organization by the year 2020. So that's one of the big we're becoming a more complex organization. So we have over 4,000 physicians who practice with us, and most of them are employed. We have hospitals. We have 10 hospitals in the United States. And speaking of complexity, we just acquired 5 hospitals, or went into operations with 5 hospitals in Puerto Rico. So we're not only now in the United States, but we have ventured into international waters. So very much a growing organization with complexities, but we also try to stay simple.
What's unique and challenging about this diverse patient population and the clinical areas you focus on?
What's unique for us, we're a typical integrated delivery network, but we are in a very competitive market in the Central Florida and in the Florida market for sure. And as I said, we are now venturing overseas. So very, very competitive. So some of the ways we have to work, especially when we talk about digital and IT, we have to find a way to differentiate ourselves in a very competitive market. And we are with competitors who have deep pockets. So we really make sure we're innovative in terms of how we approach working with our physicians. We are physician loyalty is one of our strategic imperatives. Staying healthy, having healthy margins. So strengthening our economies is another way that we make sure that we stay competitive and that we differentiate ourselves. The quality care that we provide our patients also is another way that we know it's challenging, but we really try to make sure that we stay differentiated in those areas.
You talked about 2 things there, or many things, but specifically the competitiveness and margins. Healthcare industry, especially for providers, very challenging macroeconomic, right? Inflation, job loss, pressure, depressed to negative margins. So how are you driving to growth, especially in this competitive market that you're in? How are you driving to growth? And go a bit further on the differentiation.
So Orlando Health, COVID is in our rear window, but our healthcare system was really, really struggled during the COVID. Cost was incredible, especially when it comes to labor costs. Orlando Health's leadership really doubled down and worked carefully and collaboratively to ensure that we maintained a healthy, positive margin even through COVID and still. So even though we may not be in the top 10 of healthcare systems in the country, we have one of the healthiest margins in the country because we are really focused on making sure we do things like ensure we have good length of stay with our patients. We do work to avoid readmissions. We also ensure that we are providing the best experiences for our patients. And we manage our bottom line. We manage our capital investments. We manage our expenses really well so that we can, stay focused on doing all the things we want to do and all the ambitions that we have. We can do that without depressing our bottom line.
How do you balance that budget, that pocketbook between running the business and innovating, especially innovating at scale?
Yeah, so as I mentioned, we maintain that healthy margin so that we can get the capital to grow, because we realize that for us to be relevant in the healthcare business, we have to have a certain scale and size. So with a healthy margin from an OpEx perspective, we're able to take some of that revenue and invest. We have it for capital. So that's the money that we're using to acquire physician practices, to enter into business in Puerto Rico. So that's how we are staying competitive and growing. And in terms of innovating, Orlando Health also has we have Orlando Health Ventures, and we also have a foundry. So we work within our health system and outside of our health system to find innovative solution, and that includes IT innovations or digital innovations. And those are some of the ways that we stay competitive and we diversify our portfolio so we do well.
Can you give us an example of something that you are implementing or rolling out at scale?
Yes. You know, I'm going to take us back a little bit because we've been doing a lot over the last 5 years, especially. When I came in I started as CIO. When I came in, one of the big tasks that I had was to remove all of our disparate electronic health. We had tens of systems that were running our electronic health records and our revenue management system, population health system. So that's where I started. The organization really invested in IT. They set aside a large sum of capital. That capital that I spoke about, they set aside a certain amount for IT to modernize our infrastructure. And then we were able to acquire Epic to replace all of our disparate systems. So that gave us a really, really good foundation. And then over the last few years, they've said, okay, now let you have money to run and maintain the business. We also will set aside some money for you to transform and grow the business. So the whole Epic part was growth. And now we have, we're able to be doing digital. So we've been working between Epic and one of our local startups. We've been able to implement a digital front door that we have been scaling to do all of our virtual and digital interactions with our patients, with caregivers and our patients. So for example, one of the things that we scaled on our digital front door is our virtual sitter. Again, back to coming out of COVID, costs were high for virtual sitting. Every hospital in the country were looking at the cost for sitters because it was one-to-one. And, my CFO and the CEO said, we really need to do something about that cost. Because we had that platform and we had scaled that platform in terms of we are able to do different use cases with it, we were able to flip to virtual sitting from one-to-one sitter to 1 to 15 patients being virtually sat, and we were able to remove millions of dollars in cost for virtual sitting. And we not only removed costs, we had other great outcomes in terms of preventing falls, and so many other things I could talk about.
Let's get into AI. Where are you innovating or using AI at scale?
Well, that same virtual platform and also Epic is doing a lot with AI. We have also started on our data maturation journey because, layering on top of that foundation that I spoke about, the infrastructure, Epic, a digital platform, we're also making sure our data and analytics capabilities are in a good place for us to scale AI. So there are some things that we're doing, we're starting the journey, and then some things we are scaling. So the virtual sitting on the virtual platform that we talked about, or the virtual platform, we are now using that platform to do virtual nursing, and we are beginning to implement AI there to help nurses. A lot of companies, and we're working with some of them, where they're doing a lot with, like, say, ambient EHR. That's a big AI platform where physicians can, use a phone and have a conversation with a patient, and it records it, and it eventually gets into the EMR. Not a lot of work has been done for nursing, so we're also working to scale virtual nursing documentation using AI.
And when you talked about data maturation, talk about where you're going next and how will that be a lever for revenue acceleration?
Yeah, eventually, when we get to the top of that data pyramid, we want to be able to monetize our data, because every vendor who speaks to us or calls us, one of the big things they want is they want access to our data. So one of the things we're doing, we're taking a step back and we're making sure we put our enterprise data platform in place. So we're ingesting all of our data that we have, all of our systems all over the place, whether it's Epic, Chronos, any of those things. We're bringing those into the Azure cloud. And once we have that data enterprise platform, then we're going to work with the business to take all of the analytics that they're doing all over the place and centralize that. And eventually we'll be able to monetize. So when a vendor comes to us and say, we want to do this, we say, okay, you can do it, but you're going to do it within our platform. So we can manage our data better and we can better monetize our data versus handing it off to everybody to monetize it for us.
Leadership. In life and business, there are rules, codes, norms to how things are done. Where have you been a code breaker and how did you do it?
How much time do you have? My mentality is normally, ask for forgiveness versus permission. And that's been innovative, right? So again, the organization has invested in a lot of the work that we're doing. Our ratio of IT spend compared to others is pretty good. And so with that, I have been able to work with leadership to say, keep expanding what we're doing in IT. So for example, my role, when I started with the organization, I was a chief information officer. And I worked with, the CEO to say, let's expand this to chief digital and information officer. That was different, right? And then I said, okay, I have IT, I have digital, I have biomed. Let's do supply chain because all of these are synergies. So it's because I think outside the box and I don't follow the conventional rule as to what a CIO should be doing. I'm like, let's do all of this. Let's break the rule and put all of these together because it supports the organization better. So that's an example of breaking the rule. There are others I could talk about.
Novlet, thank you so much for joining us.
Thank you for having me. And hopefully I shared something that, someone can take from. So thank you.